Hello, Dr. Brashore and classmates. Today I'm going to talk to you about improving value by decreasing culture result times through Six Sigma and cost-effective analysis. I work on an orthopedic unit at Baylor University Medical Center. On that unit, we deal with a fairly healthy population. We have people there for voluntary procedures, whether that's a total knee arthroplasty, total hip arthroplasty. Those are the most common. Total shoulders. The biggest risk, though, is post-op infection. Whether that's right after surgery or down the road, the hardware they're implementing can grow bacteria and cause infection. The biggest delay of discharge we see are on these patients who come back with infection because we're waiting on a lot of things for their care that we'll get into in just a little bit here. So some of the common diagnoses we see, the top there, osteomyelitis, a lot of diabetic patients we see with that, infection of hardware, something just didn't go right in their knee. They had a pre-existing infection, they got an infection and it migrated to the knee, or septic arthritis, some type. They're doing some injections and some bacteria got in there and is causing an infection in there. So often the care plan that we see with these guys, with these patients, they're going to draw blood cultures and then start on broad spectrum antibiotics. They'll most likely take them to surgery for an incision and drainage. They'll replace the knee hardware. They might even wait a little bit, and while they're waiting, they put in an antibiotic spacer. The patient can't bear weight on it while they're getting IV antibiotics for 6 to 8 weeks. Then they'll come back in and get the joint replaced. And then amputation is always some type of possibility, especially with osteomyelitis when you have necrotic tissue. The biggest thing I'm going to focus on here through Six Sigma and lean processes is waiting for culture results. Why do they take so long? Is there not a better way to get these back faster? Why don't we have ways to get them back faster? Because while we're waiting, there's a lot of complications with waiting on culture results, what's going on with the patient that we'll get into a little bit. After we get the culture results back, the patient's going to need to get cleared for a PICC line, and then they're going to have to go outpatient, either home to a skilled nursing facility for 6 to 8 weeks to get these IV antibiotics to try to clear up this infection. So let's talk a little bit about the goals of Six Sigma. So the goals of Six Sigma are to eliminate defects and errors. We're going to reduce cycle times and the cost of operations. We're improving productivity, increasing customer experience, and improve asset utilization and increase return on our investment. So what I'm focusing on is reducing cycle times and the cost of operation. Why is the process of getting blood culture results or tissue results back taking so long and prolonging our patient's length of stay? If we can decrease length of stay, we're improving productivity. We're getting these patients on the correct antibiotics sooner. We're increasing their experience because they're not sitting in the hospital for, sometimes they can sit in the hospital for a couple weeks waiting on results, then to get their PICC line, and then to get the antibiotics set up, make sure the insurance gets approved for where they're going. And some patients just get frustrated with all the loopholes that they have to jump through, that we could just make it a little more seamless if we can identify bacteria a little bit sooner. So let's talk a little bit about Six Sigma. So we have the DMAIC acronym that we're going to use here. We're going to define the process and the problem, which I've already done. We're going to measure. I'm going to get a little bit into that using the lean tools, the next slide here. And then we're going to analyze those results, and we're going to try to improve this process to try to make patients safer, have better outcomes, and then we're going to maintain this improved process. But all the while, we can always go back and forth, it's always a fluid process trying to improve how we're doing. We're measuring this, defining new problems that we can improve the process even further. We can refine the process. So to use that, we can use a lean tool which is a Pareto chart. Main thing with lean is we're trying to identify values that are non-value added non-value added activities in the workplace we're trying to identify. So what are we doing that's having no value? So we're waiting on culture results. Okay, the patient's sitting in their room, they're getting broad spectrum antibiotics. Why can't we speed this up? It's causing a delay of discharge for them. We're just waiting on this one thing because there's nothing else we can do. So if I was to do a Pareto chart and we're tracking patients with an increased length of stay, it's most likely going to be patients with the above diagnoses that I showed you of the osteomyelitis, the septic arthritis, the infected hardware of joints. Those are the patients who have our increased length of stay. So we can also track some other things on there, but the most important, most likely cause would be that. So let's look at what the evidence says now that I would have said, hey, we have an increased length of stay due to these infected joints because they're waiting on culture results. What does the evidence say about what we can do to increase these culture results? Are there any new technologies out there? So I did a little research. There are a lot of new technologies available for rapid bacterial identification. By doing this, we're decreasing the spread of infection by getting the right drug to the bug sooner. By decreasing negative outcomes, we are identifying the bacteria so that the patient doesn't become septic. Maybe we're thinking it's the wrong bacteria, so maybe something else happened, and we're not even treating it with the broad spectrum test. Maybe it's fungal. We don't know. But if we can rapidly identify it, we can treat the patient sooner and improve their outcome. Also, we're decreasing the misuse of antibiotics that contributes to antibiotic resistance. That is a huge problem that could occur if we don't have antibiotics that are fighting these bacteria. Become multiple drug resistant organisms where we begin to fight because we've been using these broad spectrums for so long. But one of the downfalls in the study is that these technologies are expensive. They're new. They're not all FDA approved yet. We're still working through that to see how really effective they are in identifying these bugs, because there's a lot of these technologies, which I'll show you here soon. But the culture and sensitivity, the old-fashioned way, putting it on that petri dish and growing it out, it's slow. It can take 2 to 6 days sometimes. It is very accurate though, but it needs to be replaced with newer technology. The culture and sensitivity is out of date, but it is cheap. Facilities like it because it's cheap, it's accurate, but the patients are at risk with this. There are definitely improvements. So another article showed us that we have the different present, emerging, and future technologies that are available. So we have the sample collecting here, as you can see with the patient here. And the traditionally cultures can take anywhere from 24 to 96 hours. But some of this emerging technology here, which I'll get into the molecular and image-based biochemical methods, sequencing technologies, they can take this is 5 minutes right here that these results come back. On day 0, we can identify the correct bug to give them the right drug to treat that, which would be a huge groundbreaking therapy for many reasons, which we'll get into here. So we'll do a little cost-effective analysis, pros and cons here. We have decreased antibiotic resistance for some of the pros. Rapid drug-to-bug identification, like I was talking about. We'll have improved patient outcomes because we have decrease in sepsis rates, sooner discharge there with a decreased length of stay. But some of the cons, it's very expensive to implement. This web link right there shows that the VA, just for 2 facilities, they implemented a program called BioFire, and it cost them almost $4 million just for the implementation of the equipment, not to mention all of the other costs that come with that. And also, like I said, some technology is waiting FDA approval. Well, move me out of the way. I have a quick video to show you about BioFire.
The film array is the most comprehensive molecular diagnostic platform available.
It's completely changed how they practice medicine. Instead of guessing what's wrong, they know what's wrong.
You know, people didn't believe us at first.
We're in the middle of a paradigm shift in infectious disease testing.
When you move into syndromic testing, the idea there is that the physician identifies the syndrome.
Physicians can't always tell what's wrong with the patient just by clinical symptoms alone.
So it's an aid to the physician in a way that's not been available before.
It's exactly what we've been missing all along.
This is the only molecular assay that we have that we're able to run 24/7.
I knew instantly we had something with the film array. The film array allows you to test for all of the common causes of a given symptom.
It allows them to make better clinical decisions depending on the particular isolate in question.
So the focus of the film array is to provide an answer to the clinician, the laboratory, and most importantly, the patient. The combination of fast, easy, and comprehensive is really powerful.
So the quick turnaround time for film array is an incredible asset because it lets us have an immediate impact on patient care.
The speed of film array is so important. You have a patient in front of you, they're critically sick, and you want to know what they have.
The main advantage of the film array is that it can identify what's causing a patient to be sick and get them on the right treatment quickly.
Very, very quickly, we know exactly what to do with that particular patient. So with one film array system and multiple panels, it's so easy for the laboratory now to be able to make a diagnosis for many different syndromic types of illnesses.
When we switched to the film array, again, our techs thought they had died and gone to heaven.
As a laboratorian, the best feature is it's easy to use.
Comprehensive means testing for most everything that can cause a syndrome.
The comprehensive panels that the film array has are a tremendous advantage because it increases your odds of making a correct diagnosis or making a diagnosis at all.
There are three things that really differentiate and characterize the film array: easy, fast, and comprehensive. I hope that our lab partners see BioFire as helping them play a more prominent role in healthcare.
So it makes them more engaged with the laboratory and they feel like they're really having a great impact on patient care. Without the ease of use, that would be impossible.
The film array is the most comprehensive molecular diagnostic platform available. It's one instrument, but it runs the RP test, the GI test, the BCID test, and there are more to come.
Use the film array when you want to know what's making your patient sick.
So as you can see, there are some technologies out there that are going to help aid us in identifying bacteria quicker. I just want to show you real quick back a few slides. The film array is this molecular image-based emerging technology. They're showing you that they have some of the new technology out there. One of them mentioned was blood cultures. So I looked at I want to really show you why this is cost effective. Yes, the technology is expensive, but is it going to save us money in the long run? Is it going to provide quality to our patients? So I looked at a study that was looking at fungal infections, and they used a molecular and image-based testing, which we're going to call T2, which they use in the study, and then traditional blood culture tubes and testing, which is BC. The T2 resulted in 3 to 5 hours compared to 3 to 6 days. So on day 0, you could put your patient on antifungal that would treat the infection. Whereas in 3 to 6 days, we're not even sure it's an antifungal. They're on broad spectrum antibiotics. This patient could be getting really sick. The results showed that a standard hospital would save approximately $6 million in total costs and that rapid results from the T2 could lead to decreased mortality, approximately 32 deaths annually they estimated in the study. That alone, saving you $6 million and improving patient outcomes by decreasing deaths from fungal infections or sepsis 32 annually, that's an outstanding number that these technologies are going to provide for us in the future. So will it provide value? Absolutely, it's a no-brainer. Just some of the small evidence that I could find shows that new lab technology provides value and benefit, even though it's costly at first. It's going to save money in the long run and improve patient outcomes. And there's more FDA approval to come for new lab techniques. Like the BioFire I showed you, those are just limited to those 3 studies that they showed you, but they said there's more to come. There's all this other technologies that I was showing you above, the emerging and the technologies that are going to come to help identify these bacteria sooner. And this also is going to help with the 2 national quality core principles with the Healthcare Financial Management Association posted. That is going to make our care for our patients safer by being able to match the bug to the drug sooner, and we're promoting effective prevention and treatment practices for the leading cause of mortality. Sepsis is one of the most leading causes of mortality in the US. So if I can identify and get these septic joints treated sooner, we're going to decrease mortality just there. But as a healthcare system as a whole, sepsis is a huge issue, and this will help that as well. So does this result in value improvement? Also, the Healthcare Financial Management Association talks about value improvement, and what a quote from them says that it aligns value metrics with the triple aim of improving care for individuals, which we would be doing, improving the health of populations, which we would be doing. They'd be healthy for longer, decreased drug resistance to antibiotics, and reducing the per capita cost of healthcare. We're saving $6 million in disease prevention from they would be getting sick, sepsis, the treatment that comes with that, with vasopressors, antibiotic treatment, getting the expensive antibiotics for multi-drug resistant organisms. We're preventing that and improving value for the care. So let's recap what I was talking about and what I really identified. I identified that culture wait times are a cause for delay of discharge in my area of work, and through a lean Six Sigma process, I identified that, and I'm trying to improve that by showing you that this is cost effective, that we're having a cost savings through bacteria identification, improve patient outcomes through safety and satisfaction, and increasing antibiotic stewardship, decreased length of stay. So thanks for listening to my presentation. I hope you learned a little bit about decreasing culture result times and how I identified that process through Six Sigma and showed you that it was a cost-effective process. And I hope that will be implemented in the future and help improve patient outcomes. Thanks.